right, we got Dr. Pasu, and I'm sorry I can't pronounce your name. Piampongsan?
And my surname Piampongsan.
Pumsat. Okay. We got Dr. Pasu with DHT clinic, but it's full hair restore, correct?
Fullhair by DHT clinic. This is the second branch of DHT clinic.
And you were trained by Dr. Patham Banich, which many
Yes.
know as he's kind of like the godfather of hair transplants in Thailand. He's
Yeah, right.
basically everybody that you know of that's good in Thailand worked
Principle
with.
of FUT surgery.
Yeah, yes, exactly. I believe it was actually the first doctor from Asia. Yeah, thank you so much for joining the podcast. I'm excited to, know more about you and the clinic and know more about your technique. You did mention something just a bit ago in terms of FUT and how Dr. Path was sort of like the pioneer of
FUT
in
surgery.
so do you do FUT or are you more FUE?
I do both technique.
Take me through a day as a patient at your clinic. There's a lot of doctors who have their name on the clinic, right? And maybe they're only doing either like drawing the hairline or they're doing just incisions. What process do you follow? What steps of the surgery do
Uh,
you do?
Process of the surgery is first I do a consultation with myself. I draw the hairline, I measure the area, I calculate the number of grafts. I perform the FUT or FUT surgery by myself. I make a pre-made incision and then my assistant will insert the hair graft.
So for FUE, you do the extractions yourself.
Yes, every graft.
And you do pre-made slits, and do you implant them with forceps or with implanter?
They use a forceps.
So basically, you're involved from the consultation. Like if I was a patient and I wanted to go to you, you're involved from the consultation
Mhm.
to the pre-op hairline design, whatever it is, to the extractions. You create the site, and
Yes,
the only portion of the surgery that's carried out by your nurses is the implantation of the grafts.
that's correct.
Would you mind sharing your screen and showing us some of your results, like some interesting cases?
These other patient and for FUE, this is a Thai patient, didn't hairline.
Wow, that's a so how much did you lower his hairline?
Normally, it depends on the proportion of his face, maybe 7 to 7.5 centimeter from the gallbladder.
Okay, so that's about 7.5. So this is the same patient, right? Oh, this is a female patient.
This is a this is a male patient. This is a new case. This is a transgender patient. This is
That's the
from
feminizing hairline.
This is from Brazil.
Looks really good, looks really soft. This is FUE. And this is at
Yeah,
4 months?
4 months.
Wow.
This is a combo. This case I did combo FUT and FUE from his beard.
How often do you do beard hair transplants?
Maybe one case every 2 months or something. But it depends. It varies from person to person. If he have enough uh, scalp donor hair, I won't do the beard to scalp. Okay,
That's
this Thai
very, very
patient,
good. That's a
Thai patient
combo.
combo. Yeah.
How many grafts can you get in one session from a combo usually?
Oh, the maximum that I had it is 5,500 graph. Around that, I do FUT, FUE from scalp, and FUE from beard.
How many grafts have you done, like, in one patient, like, over surgeries? Like, let's say the patient does 5,000 grafts first and then comes back to you, does another
No,
2,000.
5,000. In that case, I did 5,500 graph in 2 days.
But have you done, like, what's the most, grafts you've done on a patient over several sessions?
For session, around that, not more than 600, 6,000 graph.
And all your patients, do you start them off on, medical therapy like finasteride,
Yes, I,
minoxidil?
re- I recommend my patient to take hair loss medication, finasteride, minoxidil, or dutasteride to keep his existing hair. Otherwise, in the future, will look funny if he has a strong genetic of hair loss.
That's incredible. I mean, that's a lot of density that he got.
Thank you.
Super impressive work. I was wondering if Maybe you'd be willing to kind of look at some cases here on the forum and answer some questions. Your opinion, no medical advice or anything like that. Hair transplant gone really well. Nothing to say about it. You'll find some pictures of my evolution since then to give you more context. Every day I take 5 milligrams minoxidil, 1 milligram finasteride. The issue is that today, so 10 months after hair transplant, when I brush my hair, wash my hair during the bath, I have a lot of hairs that fall. I don't understand why, and I'm almost sure that the hairs falling are transplanted ones. Please help me understand why they're falling and if there's anything I can do to make it stop. So this is his pre-op, right? This
Mhm,
is, I guess, the graft distribution. The
mhm.
hairs here, grafts again. As the hair transplant started to grow, it grew pretty well. And then those are the, I guess, hairs that are falling each time he brushes his hair. What are your thoughts on that?
10 months after surgery,
10 months after surgery.
we have to look for the cause of the falling hair, like telogen effluvium.
The only logical explanation would be what you said, right? Telogen effluvium. For some reason, his hair is going through a shedding phase. Telogen effluvium, which can happen from stress. So, Dr. Pasu, as someone who does both FUE and FUT, there's been a lot of debate over the years. Not so much now, but a lot of debate over the years as to which technique is better, which technique grows more. And I was asked this question last week when I joined a podcast with a doctor from New York, and he asked me point blank, which technique do you prefer? And I told him from the patient perspective that for me, FUE is always going to be superior in the right hand. Following reason: less invasive, less downtime, less pain, less visible scarring. So for those reasons, in the right hands, like if you have a doctor who knows how to do the extractions, the grafts grow.
Mhm,
In the right hands, it's going to be superior always to FUT as a patient for me. This is my opinion. But what's your opinion
understand.
as a medical doctor who does both?
I think both technique are the good technique in hair transplantation. Now, FUE is promote. Maybe it's need a smaller team. The doctor maybe not to have a high experience in FUT surgery, and they can do the hair transplant. But the downside that I quite worry about FUE is over harvesting if they are in the wrong hand.
Pretty much all the doctors that were doing strip are now doing FUE, and they're going to get better. Doctors are going to get better. And I think in 10 years from now, FUE is going to be very, very, very good. And I think FUT will always have its place, especially for women. I think it makes sense for women because women don't want to shave their hair to get a hair transplant. So FUT makes sense for that. For transgender patients, I think it also makes sense. For certain cases, FUT will make sense. I may get some pushback for this, but I think in 10 years, it already is about 75% of this all surgeries based on the ICHRS is FUE. But in 10 years from now, I think it's going to be 90%, maybe more. That's my prediction.
Okay, I agree with that. FUE is more popular, but in some cases, FUT still have their place.
I also think that a novel approach, and I think one that more surgeons are going to start adapting, is the combo. I see a lot of doctors doing combos.
Mm,
Doctor in Switzerland, I don't know if you know him, Dr. Sever Murasanu. He does combo FUT FUE to get more grafts. Doctor in England named Ted Milne
mm.
does he did a combo FUE FUT, did about almost 8,000 grafts. There's also been something that's been proposed by a few surgeons, and I don't know who's right or who's wrong, but some surgeons feel that doing FUT and FUE, you have more lifetime grafts.
FUT can save your donor hair. I prefer to do both technique, but in the patient who has a Norwood class 5, 6, or 7, I usually start with FUT or combo, not FUE, in order to save his donor hair for the future session that he definitely need.
What are your thoughts on DHI?
DHI, I think DHI is just a commercial term. They use an implanter. Okay, it's implanter, sharp implanter insert the hair
Do you
graft.
think there's anything to, the kind of the idea behind DHI? And a lot of people, you're right, it is commercially like it's kind of become like a gimmick. The thought behind it was that you extract the graft, you immediately put it in the implanter, and you implant it so that the graft is not out of the body for long and it survives. What are your thoughts on that? The basic theory behind DHI?
If you extract the graft and implant it immediately, maybe you need two doctor to do that. because you use a sharp implanter.
I mean, I think the idea behind it, it does make sense where, okay, the grafts are not gonna be sitting out, they're not gonna dry out, there's no chance of them drying out. When people bring this up about the grafts out of the body, we have evidence that, like I mentioned before, Hassan and Wong, they used to do 8,000 graft strip sessions. You're talking about starting at 6 in the
Mhm,
morning, ending at midnight, with the grafts being outside of the
mhm,
body for hours, for maybe 7 hours, 8 hours,
many
yeah, for a long, long time in holding solution, and those grafts survive. What is your thoughts on temple point? A lot of patients
mhm.
want the temple points, but some doctors don't wanna do them. Obviously, they're very, very difficult to make natural, and if you make these unnatural, it could be a disaster. What are your thoughts on that?
I don't do the temple in the young patient because they might have a chance to have more hair loss in the future, flat ankle.
Yeah, so for young patients, you don't do it. For other patients, you will do it. Let's see if we
Mhm,
can find. So this right here you can see you kind of did the temples. There's only so
mhm,
there you did the temples. Here you kind of did the temples as well. And that's an
mhm,
incredible
yeah,
result, by the way.
6,
Here we go. This
6 or
is the
7.
temples.
Oh, this case, this is a congenital hair loss. This problem is called temporal triangular
Mm.
alopecia. He didn't have hair on the temple since born. This is a congenital hair loss. So I have to correct his problem. He is a model.
Yeah. Wow. It looks amazing. This is a diffuse. I believe this is the patient you showed us, right? Combo.
Yes.
So here we can
Co-
kind of close up a little bit. Look how soft that is. Look at the little baby hairs. And it's very hard. I mean, I think what people also should recognize as well is you mentioned something about the density with Europeans and Asians. Asians have less density, thicker hair.
Yeah.
Europeans have more
Go
density,
ahead.
thinner hair. With a blonde patient with fine hair, getting a really soft hairline isn't as difficult. Whereas like a Asian patient with really thick hair, getting that soft hairline it's not that easy.
Mhm.
Yeah, that's really impressive work.
Different.
So the question that you get a lot of patients asking you is like, why is my hair not growing at the same rate? So this is a good question
Yeah.
because I see on the forum, I've seen with the same doctor. So the same doctor, same technique, same team. One patient at 3 months, 3.5 months looks incredible. Looks like you can see the hair's just already growing. The outline is there. You can tell that
Yes.
this in 2 months is going to be like almost the full result. Whereas another patient at the same time, same doctor, same everything, they're completely bald. Like
Fighting.
not a single hair has grown, not one. And yeah, this leads patients to start to worry, and they start to ask the doctor like, "Hey, what's going on? What is the reason for that? You think?"
Or maybe genetic, the medication, supplement that they take, anything. I think we have to inform the patient that full result of hair transplant may take at least 1 year or some rare case up to 1.5 year after hair transplant.
Some people they cut their hair one week, the week later, it's like they didn't cut their hair. Their hair grows incredibly fast. Other patients, other people, they can cut their hair 2 weeks, 3 weeks, and the hair doesn't grow as fast. It's just for whatever reason, the hair either grows really fast or it just grows slower. Right. Well, if people have any questions, where can they reach you? All right. So, if you guys want to DM Dr. Pasu, you can find him at Fullhair underscore by DHT Clinic on Instagram. You
Yes.
can also check out his website, which is fullhairbydhtclinic.com. Thank you so much, Dr. Pasu, for joining the podcast, and I appreciate you. I know it's getting late in Thailand, so thank you so much. All right, till next time.
Yeah.